Just want to say good afternoon and welcome to our latest Beyond the Fill webinar, Equipping for Vaccination and Other Medical Billing Now, featuring Provider CSAO. If you attended American Pharmacy's Apex conference last year, you're already familiar with today's featured speakers, Will Burnson and Preston Cranford. We hosted a webinar with Will and Preston last August, and this and other recordings can be accessed on American Pharmacy's YouTube channel when convenient for you. To register for this year's conference, visit our new and improved website at aprx.org, then navigate to the Apex tab at the top of the page. We look forward to hosting Provider CSAO at Apex again this June, and in preparation, our goal is to help pharmacies position themselves optimally for both Apex and the 2026-27 flu season now. Pharmacies don't often have the opportunities to be proactive, but where possible, it's typically to their advantage to do so. I think it's important to quickly note how strong a resource Provider CSAO is for independent pharmacies. American Pharmacies has had the pleasure of working with Will, Preston, and team for some time, and the expertise and efficacy they provide to their customers, to our members, and to the co-op and partnership is exceptional. They're more than just a source of knowledge. While pharmacies care for their patients and manage their businesses, Provider CSAO works diligently in the background to help pharmacies get in network and enjoy maximum reimbursement. If you haven't already, I highly encourage each pharmacy with us today, especially American Pharmacies members, to connect with Provider CSAO to discuss how they can help you advance credentialing and contracting for your pharmacy business. Few pharmacies have the time, personnel, and understanding needed to successfully manage this ongoing workload, making the value of a quality group like Provider CSAO very clear. A growing number of your peers participating now would absolutely agree. And with no further delay, I give you Preston and Will. Thanks.
Thank you very much for the intro, Jeff. We really appreciate it. And thank you to everyone here who is joining us today. We appreciate you sharing your time with us. I know, especially over a lunch hour on a busy day, it's very valuable, that hour of peace. So we really appreciate you guys joining us with it. Like Jeff said, my name is Will. I am one of the co-founders of Provider CSAO. I'm thrilled to be here with my co-founder, Preston. If you'd like to say hi, Preston. And today we're going to be talking about vaccine season this year with a specific focus on why it's important to get started now. We believe that preparation will be key for maximizing the revenue that you'll be able to find this fall. And we'd like to explain why we believe that is. We'd like to give you a quick course in what the differences will be as you move through. So that being said, I'll hop over and share an outline of where we are headed today. So first, I'll do a quick introduction to Provider CSAO. It'll be very brief, and then I will hop into vaccine billing preparing for fall. Like I said, that is the focus of today's webinar, and so we're going to talk about why you should start now, what the different aspects of starting now will bring you, and how much better you'll be equipped. From there, I'll pass it over to Preston, who will talk a little bit about coding differences and how pharmacies change their workflows and coding to be able to bill these services to commercial medical payers. After that, we're going to spend some time and talk about another benefit to getting started early, which isn't necessarily preparation for vaccine season, but rather equipping yourself to bill for the clinical services you're providing year-round instead of just in a 4-month window. Then we'll wrap it all together and talk about Provider CSAO's role a little more in depth to explain how all of those pieces come together by working with us. And then at the end, we're very excited to have a real pharmacy who's been working with us for a few years now and is also an American Pharmacies member. And we will be welcoming him on to answer some questions, talk through his experience, and tell you what it all has been like. So, that being said, a quick introduction for Provider CSAO. We are a clinically integrated network of pharmacies. What that means is we help pharmacies establish contracts with commercial medical benefit payers so that they can bill for clinical services. So that integration is both within for all of our members as we're all a resource for one another, and without as we are able to start working with more and more medical benefit payers. And what all this means is that medical billing can now happen beyond Part B. Previously, pharmacies were limited only to billing for traditional Medicare. And there were two issues with that. The first one is that the scope of services that pharmacies could offer ended up being very limited, mostly to vaccines, diabetic education, and point of care testing. And in addition to that, more and more patients are leaving traditional Medicare in favor of Medicare Advantage plans. And so what that means is not only is the scope of services you can offer very, very limited, but that patient pool that you can offer those services to is growing smaller and smaller each year, which means there's less and less revenue each year that you'll be able to earn from billing for those services. Another really interesting thing that we have found the more we work with pharmacies is that you all are offering far more clinical services than you think. When we started this, we were talking to a lot of pharmacies and mostly focused on vaccinations, point of care tests, hormonal contraceptives, and medication therapy management. But we have learned over time is that pharmacies are providing far more clinical value than just those things. And then when we start with pharmacies who are initially hoping to bill only those services, over time they've learned that they can earn for every clinical encounter that they're having with patients. We'll get a little more in depth into what those different clinical encounters are as we go through this webinar. The payer groups that we help pharmacies earn reimbursement from, we don't work very much with Part B. We are happy to help our pharmacies apply for and obtain a PTAN so they can bill to those. But really what our goal is to get pharmacies billing to commercial private payers, Medicare Advantage payers, and MCO, so like state Medicaid, especially those that are administered by commercial payers. And additionally, of course, we are offering ongoing billing support. We'll talk a little bit more about the support and the ancillary benefits as we go. But as a quick introduction to who we are, that clinically integrated network of pharmacies who are billing to commercial payers is key. That being said, let's start talking about vaccine billing and why it is important to prepare for fall now. It is February, we are aware. So why are we talking about something that happens 6 months down the road? There are a few reasons that we're doing that. So the first one is timelines for contracting with payers. Contracts with commercial payers do not happen overnight. While we're able to get pharmacies set up to bill in the first 6 to 8 weeks, normally is when our first claims start going out. If you want to earn the highest and best revenue from these contracts, you will want to be fully established by the time vaccine season rolls around. And the reason is the difference between out-of-network and in-network billing and what that means for pharmacies. So the first is that we get pharmacies set up to bill out of network and they're able to get those claims out. But once they get that fully in-network status, instead of just being recognized as a provider by that payer, their reimbursements will jump somewhere between 20 and 25%. And so, of course, it's really good to have that extra revenue, but when you compound that with the sheer amount of vaccinations that most pharmacies are giving, that can be a significant number. So we want to make sure that those contracts are set in stone and ready to go so that you can really get that additional 20% to 25% revenue. And the second important reason that we want to make sure that we're fully contracted is the difference in what it means for copays for patients. Normally, our pharmacies are billing out a preventative med code, which Preston will tell a little bit more about later, but those codes come with no copays for patients that are in network and pharmacies that are in network with those payers. Out of network can be hit or miss. Sometimes there are none, but other times there are. And so we want to try to address as many of those problems as we can before that time happens. Now, we also like to say that we do believe that as pharmacists are more and more acting as clinical providers, they want to shift the mindset of that and help patients understand that copays, as they are getting these clinical services, they may become part of that culture that we see in patients coming to pharmacies, but that's more of a long-term goal. And so we'll talk more about that as we work with you all and how to change how both pharmacists are viewing themselves as clinical providers and as patients viewing pharmacists as clinical providers. The second reason that we recommend starting to prepare for fall now is that more and more patients are looking to pharmacists for their vaccines. So what that means is you're going to be busier and busier every year. Recall that more than half of all COVID vaccines ever given were given in pharmacies, and more than a third of all vaccinations in the country were given in pharmacies in 2024. We don't have the numbers for 2025 yet, but we definitely expect that trend to have continued in 2025, and we expect it to grow even more in 2026 and beyond. Another reason, in addition to that increased volume, is that we think it's important to practice before the time comes, because there probably won't be time once vaccine season is here. So it's important to practice while volume is low, because you probably won't have the bandwidth to learn a new process for billing these claims once that season gets here. And there is a new workflow that pharmacies will have to learn if they want to get that reimbursement for those additional clinical encounter codes instead of just the admin codes. And if you start familiarizing yourself now, you'll already have the workflows in place and staff trained so that you can be calm and confident going into vaccine season. Another really important point that we have, and a reason to start thinking about this now instead of later, is that you will want to build familiarity with your biller. You'll want to know exactly how to use that biller because you're going to be too busy in the fall to learn that new workflow. So you will want to know how to bill and structure a claim for a preventative med code. You'll need to understand how to manage rejections and denials as they come in. And you won't want to try to learn this on the fly, because that will throw a cog into the busiest time of year for pharmacies. Another point to make with building familiarity is that medical billers will also have higher demands on them during that time. Medical billing softwares, regardless of the one you're using, they will be experiencing their highest volume of support requests at that time, for the same reason that you all will. It's going to be busier, and pharmacies that wait will end up finding themselves in a backlog if they have any questions, since there's going to be that large volume of support requests for them. And by building familiarity, you will be able to maximize your revenue because you're going to be more prepared and more confident and have fewer questions. So you'll be able to work faster, you'll be able to work more efficiently. And I'll explain this point a little bit by saying that the Seattle Seahawks this year won the Super Bowl. And they showed up to their off-season practices beginning April 22nd. The regular season did not start until September 4th. They didn't wait to run plays and work out kinks once they got to the regular season. They were preparing before the time came, and it paid off handsomely. It paid off real big with the Super Bowl, and we believe that it is going to be the same thing for pharmacies who want to win this year's vaccine season. Start early, be prepared, and be confident. The bottom line here is that setting up and learning this process now will set you up for much more profitability this fall. That being said, I am going to pass this off to my co-founder, Preston Cranford, to talk a little bit more about vaccine billing and what the coding differences will be and what you all can expect that you'll need to learn as you go into this vaccine season. Preston?
Thanks, Will. Thank you so much. So let's start off talking a little bit about how vaccine billing is different if you're billing to the medical benefit compared to the PBMs. And to start, I want to make sure we're all aware we're not necessarily talking about your Medicare Part B patients, but more so your Medicare Advantage, commercial, and even some state MCO and Medicaid programs. And before we get too deep into the coding specifics, let's take a step back and look at how the vaccines are billed to the PBM. So traditionally, we have a drug and an admin fee that are billed through your pharmacy management software. Those reimbursements are a little bit low, and but the good thing is you get that instant reimbursement. On the medical side, the reimbursements on the drug and admin fee are much higher, and you also are able to bill for an additional line item on your claim. So you're able to bill for the clinical consultation and the time that you're spending with that patient, counseling them through the vaccine. And of course, coding to the medical benefit is a little bit different. We're not using NDCs, and we're not using our pharmacy software system. We're going to be using the CPT codes through our medical billing vendors. To do that on our vaccines, we're going to use preventative medicine codes. And I say preventative medicine codes because that's the best place to start with. In some states, some payers, they'll recognize these services as evaluation and management. But check your plans that you're billing to, check your fee schedulers, and see how they want each of those coded. Once we have our preventative medicine or evaluation and management code in, then we need to tell the payer what service specifically we're doing, because those preventative medicine and E&M code sets can have such a wide range of services that they cover. So we identify the particular service through the ICD-10 code or the diagnosis codes, depending on what medical biller you're using. Of course, for our vaccines, we're going to use Z23 for the encounter of the immunization. And I'll even let you in on a little secret. A lot of our pharmacies started adding a second diagnosis code of Z71.85 for the actual consultation. And we found that there's even higher claim success when using that secondary ICD-10 code. And what this does is tells the payer we've had a clinical encounter through the CPT code, and the ICD-10 code narrows down into what that actual service was. So our pharmacies billing out to the medical benefit just on the consult alone are seeing an increased reimbursement of $30 to $45, and we even see some go higher than that for the consultation and what they're spending with patients. And while $30 to $45 might not seem a huge lift on a day-to-day, whenever you're considering your vaccine season and the potentially hundreds or thousands of vaccines that you might be doing, it can have a huge impact on the revenue that you're able to bring in Q4. Also, another important point that Will added in here for me is a reminder that if you are billing point-of-care tests and you currently have a cash model, those are also billable under the medical benefit, and you can also get reimbursed for your time spent with those patients. So now that we've covered what most pharmacies will consider their first step in clinical billing, a lot of pharmacies are already doing vaccines, so they see it as an easy way to transition into the medical billing space for the increased revenue. I'd like to ask, what if you were able to bill clinically medical claims throughout the entire year, instead of just in that 3 or 4 month window at the end of the year? What I mean by that is I'm sure you are all aware that y'all are doing clinical services every single day. And in fact, multiple times every single day. A lot of pharmacists are either legally required by law or because they love their patients to sit down and go through these consultations with them. Traditionally, pharmacists had just been doing it for free because the channels of access to reimbursement had been closed off to them. And a few examples that I'll tell pharmacies to look for in their pharmacies that they're already doing on a day-to-day basis are things like first fill consults, antibiotic consults, OTC consults, even telehealth or in-person medrecs, so medication reconciliations. We even have a few pharmacies billing outside of the consult, so things like LAI, long-acting injectable administration, continuous glucose monitors, contraceptive counseling, tobacco cessation, DME, point-of-care tests. So there's a lot more billable clinical services than what most pharmacies think whenever they're first meeting with us. What we're talking about is a different way to view reimbursement in general. Previously, it was just the medication that you were dispensing alone, regardless of what you had done with or for patients. Now you're able to get paid for that time and knowledge that you're bringing to the table. So how much time do you think you spend with each patient, and how much do you think that costs you each hour? A few things to know as you begin. I'm sure everyone on this call is at a different place in their medical billing journey. And no matter where you are, it's always good to go back to the basics. The first thing that we're always going to tell a pharmacy to do whenever they're implementing clinical services or newly joining the Provider CSAO network is start collecting medical insurance cards. A lot of the times you'll always already have their prescription card on file. Adding in the medical insurance, not only does it tell us the payer ID, which is basically the BEN and the PCN of the medical world, but it also gives you an idea of what the patients in your area hold as their medical insurance. So instead of having to look at it and shooting in the dark a little bit, we're able to go through and get a valid strategy based on what we've seen our patients carrying. Another thing that we talk to our pharmacies often about is billing directly out of their medical billing software. A lot of the times, if you're billing through the PMS, it can be really convenient to keep your workflow what you traditionally had it. But what we've seen is that pharmacies will, on any claims that need action, whether it's an incomplete or rejected claim or denied, those claims will stack up in your medical billing software and can be a nightmare to have to go back through and fix. So start billing out through your medical billing software, get your team familiar with it, and get used to that workflow because it'll make things so much easier on you down the road. The next thing that we're going to want to look at is identifying opportunities. Usually pharmacies are already doing enough clinical services that they don't need to offer new services when they're coming to us. They're really taking advantage of things that they've been doing for free for so long. And we talked about this a little bit earlier. Whenever you're counseling a patient, whether it's OTCs, antibiotics, first fills of medications, these are things to bear in mind as you're seeing them each and every day throughout your pharmacy, that those are clinical and reimbursable events that you could be taking advantage of. The last thing that we want to remind you of is documenting your claims. You'll probably hear American pharmacies talk about it. You'll hear it at every trade show. And if you've met me before, you've probably heard me say it multiple times. Clinical documentation is so important. It's what they look for on the medical audit to prove your claims. So whenever you're doing your services and you're documenting each and every one of those claims, on the medical side audit, they'll come and ask for a list of that documentation. And if you don't have documentation to prove those claims, then they can recoup that money. We have had a handful of pharmacies that have gone through audits since they have joined the Provider CSAO network. And we are pleased to say that on the medical side, all of our pharmacies have passed with flying colors. So that is a streak that we're looking to keep alive. Keep your documentation, make sure it's easily accessible. And if you're doing documentation in a medical billing platform, they all make it easier for you to go through those audits. Reach out to them if you start one, and they can make that process a lot smoother for you. Doing each of these early on in your medical billing journey sets the tone and the workflow for your clinical pharmacy for years and years to come. And it also prevents you from leaving money on the table. Each opportunity missed on the clinical side is a sunk labor cost added for the pharmacy. So I would say make sure that you go through the checklist here. Make sure that you're collecting insurance cards, learning your medical billing software and getting familiar with it, are able to identify opportunities. And if not, reach out to our team. We can guide you on doing that. And also make sure you are documenting your claims. Thank you so much. I'll pass it back over to you, Will.
All right. Thank you very much, Preston. So we talked up front about what Provider CSAO is, but after going through some of these services and the reasons that we think you need to start thinking about vaccine season now rather than closer to fall, but we wanted to spend some time and talk a little more specifically about Provider CSAO's role and how we help equip pharmacies to do these things. So the first one is that pharmacists must be recognized as a provider by commercial payers to do all of these services and bill for all of these services we're talking about. You'll need contracts with commercial medical payers before they will reimburse you, and that is where we come in. Provider CSAO is a membership-based network. We operate a lot like your PSAO. So we'll manage the credentialing, contracting, contract maintenance, and payer communications, really the upkeep and all of the rest of the administrative burden of establishing and maintaining these contracts so you can get reimbursed. Payers prefer working with single points of contacts, and we have been able to establish relationships with these payers, and that allows us to get our pharmacies contracted in the network both successfully and efficiently. There is also monthly upkeep on credentialing and contracting that can make you restart from square one on that contracting process if it is missed. And so we will handle all of that part for you so that you can continue focusing on your patients and offering those clinical services rather than the headache of the administrative part of it. There are a number of other benefits of joining Provider CSAO. I'm going to say including, but not limited to, of course, consulting on what services you can bill to each of your specific payers, including for state programs. So we are available to all of our members to meet and talk with us about things that they're looking to bill, things that they would, that they have billed and have questions about. We also hold billing trainings with all of our members on their first number of claims to ensure that not only are they able to bill out, but also to understand how to resolve denials and rejections on calls, so that you can understand not only what went wrong, but how to fix and avoid that in the future. We hop on very often with our pharmacies and their billers to get down to the bottom of things. And if needed, we've also reached out directly to payers to help resolve some of these denials to great success. So the goal here is to make sure that when our pharmacies are with us, we have a very white glove service to make sure that they can maximize the value of being in our network. So it's not just about getting the contracts and doing what you already think of as clinical pharmacy, but also working with pharmacies to really expand the scope and help them operate at the top of their license. That is where we come in, contracting, equipping, and training to make sure, like I said, we can leverage and maximize the value of being part of our network. So that being said, as promised, we wanted to take a few moments here and bring on an actual pharmacy that we have been working with, who is also an American Pharmacies member. So we'd like to welcome Mark Poling from Pharmacy 575 onto the call. Mark, do we got you?
Yep, I'm here. How are you?
All right. Doing great. Thank you very much. How are you doing?
Doing well, thank you.
Good. Good. Well, thank you so much for giving us some time here today, Mark. I'd like to start, and if you wouldn't mind, just share with everyone here a little about your pharmacy, your practice. It can be as brief as you like, just to give us a starting point.
All right, so we are Pharmacy 575. We're in Hobbs, New Mexico, in the southeast corner of the beautiful state of New Mexico. We've been open for going on 5 years in September. We opened when COVID was hot and heavy. We really, vaccines got us our business what we have today. The COVID vaccine was really a great jumping point from how we were able to grow. And so we have because of that, we have a very robust vaccine business that we do not only the seasonal vaccines, but we also do school vaccines, vaccines for children. We do immigration vaccines, and so that's a heavy side of our business. And we also have focused on clinical things, consultations, and different things like that, experimenting with trying to expand different revenue streams and sources for pharmacies.
Great. Thank you very much for sharing that. Sounds like started off with the focus on vaccines and have expanded beyond that to other clinical services and encounters. I'd like to ask, what encouraged you to make the leap into Provider CSAO and really start thinking about things outside of vaccines? What was it that prompted the start of this journey for you?
I guess the thing that desperation's the mother of all inventions. How poor reimbursements are from PBMs. That's really, I was looking for, like, how can we can't survive, we can't make it on what they're paying us. And so we started looking at different things, and I saw CSAO either on Facebook or Instagram or something, they're advertising, and I reached out. It was like, you know what, this looks really intriguing, so let's give it a try. And so here we are with it.
Well, we're sure thankful that you decided to give us a try here, and also nice to know that social media marketing has worked.
It does work.
So want to ask you as well real quick so that we can understand the scope of this. What all patients are you able to bill medically for? So think about not just Medicare Part B, but are you billing, Medicaid, commercial, Medicare Advantage? What all groups of patients are you billing for right now?
So we have 5 or 6 contracts with payers. Probably our biggest one is Blue Cross Blue Shield. With them, we bill Medicaid. In New Mexico, we have 4 different MCOs for Medicaid. And so Blue Cross being one of them, we bill for them. We bill Medicare Advantage. We bill commercial through Blue Cross. With Presbyterian, the 3 other MCOs, we just bill Medicaid. That's all they've given us a contract for so far. But we bill it, and we're a very heavy Blue Cross Blue Shield state, so that covers a large portion of our patients. So
that's helpful. Also helpful knowing that you can get kind of all 3 buckets, right? From the Advantage plans, commercial, and a few MCOs over there as well. I'll ask one more question before I pass it off to Preston. I know he has a few, but I wanted to ask, so why do you believe that pharmacies need to get into medical billing and commercial contracts?
Kind of how I alluded to with PBM payments, as you all are aware, I don't think there's a choice. I think it's you either do or die. And I think that clinical billing is a natural fit for pharmacies, where with our education and background, we need to be taking advantage of the monies that are there that are being open to us. I don't think there's a choice. I think it's just a natural fit for where our profession's headed. Because I don't know, much like the wagon wheel or the gas lamp, if you don't evolve, you're gonna go obsolete. So you gotta make the leap. You can't just rely upon legislation. I mean, thankfully there's some legislation that just passed, but you can't rely upon other people for yourself. You have to take those opportunities that present themselves. Otherwise, you'll find yourself working for somebody else.
Yeah, and that's I think really insightful too. You remind me of the thought that you don't necessarily have to wait on scope of practice across the country to move forward, since these commercial payers will reimburse pharmacies for many of these things already. So it's nice, like you said, not having to wait on others and the painfully slow process of legislation updates to start earning clinical reimbursements. And you also have given me an idea for a tagline: Provider CSAO, don't be a gas lamp.
Oh, that's great. So Mark, want to go into a little bit of the billing side. One of the most common things that we hear whenever a pharmacy is considering getting into clinical billing is we don't want to. It seems like a huge workflow change, or seems like it's going to be too much to learn. So I want to learn a little bit about your process in learning medical billing. And was it harder in your first 2 or 3 months? Did it get easier over time? Does it streamline itself to a degree? Now, what have you found in that regard?
So I had no idea. I had no idea other than doctors bill insurance. I had heard about medical billing, but that was something that was a very foreign subject to me, and it was kind of exciting though. I was excited to see what we could push the envelope on, what the payers will pay us on. But we started using Availity. It's a place where you can bill. It's a clearinghouse that Blue Cross uses. You can send claims. You can look at payment summaries for providers there. But yeah, I didn't know what I was doing. I think I used AI. I used Google to try to find out how to do it, to figure out how to bill. We did figure out how it worked. We were doing COVID tests for the schools, and we figured out how to bill Blue Cross, and it started working, and it was like, wow, this is amazing. And so it was a bit of a challenge, but it was exciting though. It wasn't like something dreadful. It's like something I'm discovering something new. I'm helping pioneer, and so it was exciting. There's other. I mean, there's several different med billers out there now for pharmacies. I don't know if you want me to tell you who we use or any of that, but
You're okay, but you definitely have tried out a few of them.
I have, yeah, yeah. That we did it by ourselves. We used some traditional EHRs, but those get pricey, like the medical ones, like the doctors use, and so you know, there's one we use that we're excited about right now. So, but I've tried a lot of them, and a lot of them make lots of promises, and they don't live up to their what they promise.
Yeah, definitely. Yeah, and you know, how I even say like each biller has their specialties and what they really focus in on and what they're great at. So finding that fit is just as important.
Great.
Yeah. So what all services are you currently? I know that we went through the vaccines a little bit. Are you doing any other medical billing at all?
So with the vaccines, what we've found is that medical doesn't reimburse the product very well, or the administration. So what we do is we still bill a PBM for the vaccine administration, and then we bill the clinical consultation to the medical insurance. And so we're seeing anywhere between $50 to $150 reimbursement, in addition to what we're receiving from the PBM. So so that's a big draw. We've we've done some consultation billing, which we've been successful on. We also made pharmacy wellness visits, which kind of looks like an MTM, but we also review the medications. We take their weight, take their vitals. We have a machine called an InBody, which looks at muscle mass. And we actually there's codes for that, and we were able to bill successfully a few times for that machine, which was like an additional $40 or $50, plus the $100 to $200 for the evaluation management. And so essentially, we'd also make supplement recommendations, and we try to do that either 6 months to a year, and we had success billing those medically.
Good deal. Yeah, and you brought up a great point there that I should have talked about in my slides. You know, on the whenever you're billing out your vaccines, you can bill your drug and admin to the prescription side. You can bill all three to the medical side. Mark is in one of those rare scenarios where he gets better reimbursements from the PBM on his drug and admin. It is pretty rare, but it does happen. And in that instance, if you're getting the better reimbursement there, you can bill the drug and admin to your PBM still, and just bill the vaccine consultation to the medical side, and you're still able to get that that additional revenue there. Thanks for bringing that up, Mark.
Yeah.
Good deal. And so you said that you thought that vaccines were really the baseline of starting your clinical services.
It was, yeah, vaccines, and I guess also COVID testing during COVID. That's really what got us into medical billing, was COVID testing, and from there we saw the other potential. And talking to you, Preston, I think is what we could see those other things we could do. So.
Yeah, I appreciate it. Good deal. And you talked about a little bit about it earlier with Will, but wanted to touch on it again. You know, your credentialing and contracting process has been streamlined, where you're not having to deal with all the administrative headaches that insurances will throw at you. How do you think that has valued you and your business?
It's definitely worth it. I mean, it's the contracting process is slow and painful, and you guys have done great. You know, you keep following up. You don't take no for an answer. You get the contracts, and you get them at higher rates than the standard, and we appreciate that. You know, when we got contracted with Blue Cross initially, it was through a long process that I had done And so it took us like 6 months to finally get on with them. And then you had something called 𝐲𝐞𝐚𝐫. You have to go on every 6 months or every quarter, and you have to have insurance and all these things you have to attest to and submit. And it's kind of painful. You know, it's an additional burden, but that CSAO was taken off of us. And so that
Yeah.
monthly fee is definitely worth it to not have to worry about it, just so we can focus on our patients and on growing clinical.
Definitely, yeah. And I always like to think back on the multiple times we had pushed Presbyterian to let us in network and what that battle looked like, and we came out victorious, didn't we?
You're awesome.
Well,
If you don't mind me asking, Mark, I think I'd like to talk a little bit about ROI. Just one quick question for you. So first of all, thank you for recommending the value of our monthly fee. But I think it's also important for pharmacies to understand what it can actually turn into. So do you mind sharing what your, I guess, highest value month was in billing clinical services? So your highest revenue generating month billing to the medical benefit.
So the highest, which I think was an anomaly at the time, but it was the COVID vaccines, and we did 35,000 in 1 month additional revenue. On average though, it's an additional like 5 to 10,000 a month that you can bring in that we brought in. So I mean, you're looking at what, 100, almost 100, over 100,000 in a year potential. That's pretty significant. So
There is a lot there, and that's what we mean when we say that a lot of pharmacies are leaving money on the table for these things that they're providing. They're providing so much value to patients, so much value to the healthcare system overall in keeping patients adherent and healthy and helping them understand drug interactions to stay away from, you know, hospitalizations or extra doctor's visits. There's a lot of value that pharmacists provide, and like I said, they've been leaving that on the table, and we believe that they should start earning some of that. So thank you very much for sharing there.
sure.
What do you think the biggest challenge implementing this into your workflow was, and how were you able to optimize it to fit into an everyday thing? I tell you, I'll ask because I'm sure that a lot of pharmacists on here are thinking, this sounds like a lot. I don't know if I'll be able to do it. So can you share some insight into what the biggest challenge was and how you were able to make it work?
The biggest challenge is just making sure well, there's a few of them, but making sure your staff's engaged with it. That's probably the hardest one. That one, I mean, that just takes good management to get your good leadership to get your team engaged and involved. But as far as like workflow, to be honest, there's not that much of a disruption because we also do test to treat. New Mexico does test to treat, and so we've had a lot of success with that. But it's just I think it's just training your staff with how it works. The software that we have now, we use it. Another thing is you need to find a good biller. That way you don't have to worry about taking care of the billing it, because that does take some time. It's not hard, but it does take some time, and also having to deal with rejections and resubmitting and things like that. If you have a good biller, a good software program, you don't have to worry about that. So that's the concern. But then it's the software that we use right now. The patient's able to either walk in, they're able to schedule an appointment. We can send the consent form to them electronically, the documents they need to fill out. They're able to give us all the information, including their medical insurance. Then once they submit it, we're able to then print out the consent form and then put it, because I mentioned that we bill our PBMs for the vaccines. We're able to then scan it into our pharmacy software and then run it like a vaccine that we do normally. But it's also still in the EHR system that we use. That way we can submit a medical claim. And that we just have to finish our clinical documentation. The one we use has an AI generated, what do you call it? It fills out your SOAP note for you. And so you just talk and it'll pick where it goes. and so that makes it really handy. It takes maybe 5 minutes of documentation, and then you're done. You should click submit, send it to them, and they take care of the rest for you. So, like I say, find a good. That's another thing, is find a good EHR billing solution. There's several of them out there. There's one that I like that I won't tell you because I don't. But if you want to ask, I can tell you. But
we'll send all of the pharmacies to you to ask, and then you can tell them. All right, so I think maybe just a couple more questions here then. Any advice that you would give to pharmacies looking to expand clinical offerings?
I would say just find out who your main payers are in your area, in your state. Then talk to Preston and Will, and they can most likely get you contracted with them. Rely upon CSAO to get those things done, because they get it done. Look at your patient population. If you have a lot of Medicare Advantage, it's looking at your patient population really, and what plans they have, to determine what kind of revenue you'll make off of the additional revenue. But I mean, there's no reason not to do it. You know, you're gonna make more than what you're putting into it if you work it, and there's not a lot of work. It's just a lot of waiting.
Definitely.
But once you get there, then it's definitely worth it. So be patient.
Well, yeah, thank you very much. It's it like you said earlier, it can be a painful process, but we do stay on top of it and try to get people billing as quickly as we can as we work toward that full in-network status. So, Mark, I think that'll be our last question for you today. Thank you so much for joining us here. We will go ahead. We've got just about 10 minutes left. So I'm going to put this slide up so that everyone can take a look at it and go over that, and then we'll go into the Q&A here. So want to do a quick note that our belief is that pharmacies are already doing so many of these services, they're just not getting paid for it. So our goal is expanding access for pharmacies to earn reimbursements, and expanding access to patients to get more and better clinical care. So if you guys are interested or have any questions for us, there is special member pricing for America's Pharmacies members. And so that is $300 a month to join the network, and $550 per contract completion, which is we'll cover that. If you have any questions for us, feel free to reach out and we'll answer all of those about pricing, about the process, anything like that. You can reach out to Randy, our Director of Pharmacy Success, at randy@providercsao.com. You can scan that QR code as we take some of these questions, or you guys can inundate Jeff's email too if you want. I won't be upset. So looking forward to hearing from you all. Bottom line is you guys are already doing so much work. We just want to make sure that you're getting paid for it. So I will leave that up, and we will check the Q&A here. Let's see. It would be helpful if we could hear his experience with the software. We would love to talk about that. I think it may just be quite a dense conversation as we talk through the different ones. And since we prefer to focus really on ourselves in this webinar, we're happy to tell you about ones that we like and prefer, our pharmacies are most successful on. If you want to just give us a call, or like I said, we can give you a referral to some pharmacies who have tried one or two others, or you can talk to Jeff and Danny as well, or your American Pharmacies rep, because they also do some time evaluating the different softwares, and they can help make a recommendation on that. So I do apologize I can't get to it on this call, but if you reach out to us, we'll make sure that we get you with someone who can tell you their own personal experiences. So next question here is, how long does the process take? Preston, do you want to talk a little about that?
Yeah, definitely. So there's not a necessarily set amount of time that the credentialing and contracting process can take. It varies a little bit by payer and by state. I always like to say that each medical payer has their own personalities and they react to things differently. We have some payers that as soon as you join our network, we get you through our general credentialing process, and then within the week you are in network with that payer. We also have some payers that can take up to 180 days, 90 days to be fully contracted. That's one of the reasons that we emphasize getting started earlier in the year, so that for some of those payers, for example, like a United Healthcare that can have longer processes, y'all have enough time to get in network and get comfortable billing them before the volume comes in. So I would say it varies a little bit by who you're looking to work with, and even on like a state Medicaid versus commercial level. But on average, we tell our pharmacies to expect about two months before you're able to start submitting claims. And we start seeing contracts on average around that 90-day mark.
And I'd like to just add quickly that what he means by billing claims out is there's a slight subtle difference between being recognized as a provider for that payer, which we file for immediately as we work toward the contract, and then being fully in network. So I mentioned earlier how the difference in out of network versus in network reimbursements, and that is how we can get pharmacies billing early on. So it doesn't take that full 120 days to the longest payers that we have to start seeing reimbursements come in. We start seeing reimbursements come in around the 2-month mark is when our pharmacies will begin billing. All right, so I've been hearing about E&M. Can you explain what it is and how I get paid for it?
Got this one. Yeah, great question. So evaluation and management was initially implemented on the medical side for time spent with patients whenever a patient would come in and it was like a doctor's office setting. Now that there are so many different practice setting types and ways that a patient can reach a healthcare provider, they've expanded it out to really be the time that you're spending with that patient giving clinical expertise. So evaluation and management is a pretty broad term for the amount of time that I spent with a patient. You'll use that evaluation and management code, which is broken into 2 different code types. There is new patient, so the first time that you're billing a claim out to that patient for that insurer, and then after that first claim, there's existing patient evaluation and management codes. Of course, the new patient, you have to spend a few more minutes with that patient, and the reimbursement is higher. Once you move into existing patient status, less time required that you're spending with the patient, and a slightly lower reimbursement, but still great reimbursement compared to the 0 that we're used to. On the evaluation and management side, you just like we had talked about a little bit earlier, you'll use the ICD-10 or diagnosis codes to point out to the payer what particular service you did that was evaluation and management or spending time with that patient.
And just for an additional bit of information, Preston, can you talk about maybe 1 or 2 of the clinical services that an E&M code would apply to that pharmacies are doing?
Yeah, definitely. I mean, a handful, and depending on the state, like if you're looking at Pennsylvania right now, a lot of their time billing is wrapped around in evaluation and management. So things like those antibiotic consults that we were referring to earlier will fall under the evaluation and management code. The tricky part is in Texas, that may be a preventative medicine code. So it's important to check in with your state and with your payers to see how you should be structuring the claims for the times that you're spending with patients. And our team can definitely help out with that as well.
Perfect. So another question here is, I don't want to have too many patients in my pharmacy due to capacity. Can these services be done over the phone, or does it have to be in person?
Great question. I'll take this one as well. So yes, evaluation and management services, preventative medicine services, almost all can be done remote on the consult side. So of course, they're not going to let us do a vaccine encounter remote because they're actually done through a totally separate code set. So we bill through a non-physician telehealth evaluation and management code. If you're billing for the time you're consulting a patient over the phone, That is a billable option, and a few things will change, like your place of service code might change based on if you're doing it in person or via telehealth. And the way that you're structuring a claim might vary a little bit as well. That's something that we want to make sure that all of our pharmacies are comfortable with early on in the process, and understand if you are doing a lot of those telehealth services, let's make sure that we have a structure to capture those.
Great, thank you. Yeah, so looks like that may have been the last question. Oh, okay, we'll do one more since we're coming up to time here. My staff does pill packing. Can this be billed?
Yeah, so just to be clear, whenever we're talking about pill packing, there is a reimbursable event included, but not necessarily the pill packing itself. So any kind of MedSync program that you have currently, that is not necessarily a billable event. But what is a billable event is maybe the phone calls that you're making to those patients to confirm their medications, or going through a med rec. Those same services that we were talking about on the last question, those non-physician telehealth evaluation and management sets, those are what we're going to use as well on our MedSync program. So it's not necessarily the pill packing itself, but the follow-up with the patient before you put that MedSync in to make sure that they understand what their medications are, if there are any adverse reactions or anything that they need to be aware of. So that right there is a billable clinical service.
Great. Well, thank you very much. Everyone, thank you so much for joining us today. We'll start to wrap it up here since we're coming up on time. Like I said on the previous slide, if you have any questions, feel free to reach out. There are a number of resources that can either connect you to us directly or can get you to us, and we'd be happy to answer anything you have. So thank you all again very much for spending your afternoon with us here at Provider CSAO. We look forward to being in touch with you.
Thank
Jeff,
you, guys.
if you want to say anything? Yeah.
Yeah, thank you, Will and Preston. Thank you also, Mark, for your time, sir. Really do appreciate that. Just quickly to one other question. There is this meeting is being video recorded, so you'll be able to access this via the American Pharmacies YouTube channel. Just go to youtube.com and search American Pharmacies, and here within the next couple of days, that will be posted along with some other videos that we have recorded in the past. Additionally, back to the just very quickly to the billing platforms, as Will mentioned, American Pharmacies has vetted a number of different billing platforms in the marketplace. We're presently focused on two specifically that we're evaluating now. I'll tell you right now, those are MedMe and RxBB. And if you'd like more information on those, please feel free to contact your American Pharmacies representative. They'll connect you with us, or of course, for anything on the contracting and credentialing side, please do get in touch with Will and Preston through the email address. If you wouldn't mind putting that slide back on the screen there, Will. I would highly recommend, for the sake of your time, if you have a question, call these folks and have a conversation with them. They're very helpful. They're very responsive. We have American Pharmacies members working with them now. It's absolutely worth your time if you want to get involved here or looking to optimize your current activities. It would be to your advantage to connect with Provider CSAO and have that discussion. And with that, I'll go ahead and wrap us up here. But thanks again to everyone for joining us today. Do reach out if we can help you, and everybody have a great rest of your week. Thanks.